Welcome to All Things Moore County, Moore County's weekly radio show highlighting the many facets of the Sandhills. That includes real estate, lifestyle, community and neighborhoods. And now, from 4 Properties, here's your host, Bill Sahadi.
Good morning and welcome to the talk show, All Things Moore County. Dorothy, we have reclaimed our county from all the excitement and the anticipation of the U.S. Open.
Yes, it's nice and quiet again around Moore County.
And it did not disappoint in any shape or form.
I'm sure it didn't.
No, we were broadcast worldwide, actually.
Yes, worldwide.
I think there was a very, very favorable light, not just on the golf course, but on the community.
Seems so.
In general. And for anyone who was glued to their TV, that last day, I believe it was the last day, they saw the eventual winner, Bryson DeChambeau, disappear from the golf course.
Yeah, he whisked off somewhere.
He whisked off to see his, what they called a physiotherapist.
Oh.
And there was I don't know if it was a picture from a blimp, but it came down through the trees, and there he was laying on the ground, probably having some sort of an adjustment done. I don't know if it was a chiropractor, a physical therapist, an osteopath. I don't know what it was.
He wasted no time making sure everything was still in proper place when he was done.
Right. And
wow.
I think it was a hip issue, maybe a hip flexor, I'm not sure. But there we had, he had his guy following him around the whole day to keep him at peak performance.
Well, it paid off.
Well, it could have been the guy that worked with him could have been my guest, but it wasn't. But
maybe next time.
Yeah, well, his name is Dr. Jonathan Cole. He's a doctor of physical therapy, and for many people in Moore County who know him, they know him from his association with the Appalachian Physical Therapy place that a lot of people who use First Health, Pinehurst Medical, Pinehurst Surgical, one of the physical therapy venues here in Moore County. Jonathan has a lot of fans who have been patients who have reached out to me in the past to talk about him. And from what I understand, Appalachian is no longer in business, and he has, in a short period of about 6 or 8 weeks, completely flipped around and started his own physical therapy place called Paragon Physical Therapy. That wasn't you with Bryson DeChambeau at the Open, was it, last weekend?
No, that wasn't me.
Okay.
But I do appreciate you having me on the show, and I'm excited to share my story and tell your listeners about the incredible clinic that we're building.
You, how long were you with Appalachian?
For a long time. Actually, when I was still studying physical therapy at ECU, I did a clinical internship with Appalachian Physical Therapy, and that was back in 2009.
Oh, wow.
And I started working with Appalachian as soon as I graduated in 2011. Became the clinic director of Appalachian in 2019 and worked with them through the end.
So you're talking about 15 years in this field.
That's right.
At least, correct?
Yep, about that. I think right around 13 years now.
And you've lived in Moore County for how long?
Since 2011, I did take a little hiatus in the middle and went down to Hilton Head, South Carolina for a few years. Okay. But this is home. My family and my wife Felicity, her family is from Moore County, and so that's what brought us here, and we've got our roots in place now.
Can I ask what happened with the closure of Appalachian and then the opening of Paragon? How did that all come to pass?
Right. So, pretty big story there, and we can just jump right into that if you'd like. With Paragon Physical Therapy, the owners lived in Virginia. We had 4 clinics total. 3 of them were in Virginia and the Shenandoah Valley. And then we had our clinic here in Pinehurst, which had actually been here since 2002. So they had a long standing, and the owner came down. It was April 17th of this year, and we were talking, and there were a few variables at play, and he essentially said, well, we're at the point now where my wife and I are ready to retire, and we're closing down the company, and we're planning on closing the clinic here in Pinehurst at the end of May. Mm-hmm. And so that was about 5.5, 6 week notice at that point. And at that time, when I learned this information, I didn't really have a heads up. I wasn't prepared for this, and so the first thing that's going through my head is, oh my God, I'm going to have to find another job, and I'm going to have to tell all the employees here that they're going to have to start the job search as well. Uh-huh. So that was on a Wednesday. So over the weekend, my wife and I were just kind of going through everything. Do I start looking for a job? Where am I going to work? Do I get a contract position somewhere? Are we going to have to relocate? And it was very stressful those first couple days, just trying to figure out, even to find a new job in our field within 6 weeks is very difficult, especially finding a place that you want to work for a long period of time. And so we also said, well, is there a way that we can open up our own place mm-hmm. and stay in this area and do things the way we want? And we essentially worked out a plan where we decided we could take over the Appalachian Physical Therapy clinic as long as we could stay in the same place and keep the same staff. That was the only way it was going to work out. So the next week we went in. The other employees didn't really know what was happening yet, and so we had a big meeting on Monday, said, okay, this is what's happening, and we'd like to try and keep this going. We have a very good reputation. Mm-hmm. All of our staff really enjoy working there. We have a fantastic group of physical therapists and administrative staff.
Right.
I said, if you guys want to keep working here, and if you want to keep the team together and keep doing it the way we're doing it, we'll do our best to purchase this clinic and make it happen. And I said, but I need all of you. If you guys want to take this opportunity to do something else, that's fine, but we need to know now because it's going to influence the decisions of all of us. And fortunately, everybody said, hey, we're on board. We don't want to go anywhere. Let's keep this going.
So basically, you're in the same physical location.
We're in the same physical location. We have the same staff.
Right.
Essentially everything about the practice is the same in terms of its operations.
Mm-hmm. So it was the couple from Virginia that owned the Appalachian Clinic.
That's correct.
Okay. So you purchased it from them.
Correct.
Okay. So in the short period of a month and a half, you became a business owner, and you haven't dropped any of your responsibilities for what you do.
That's correct. So through those 5 or 6 weeks, I continued to treat a full caseload, and oh my gosh, it was so much. I mean, we had to come up with our company name. We designed a logo. We started working out the logistics of how we form a business. We then registered our corporation to the state of North Carolina. Had to get our federal tax ID number. We had to get our NPI number, which as a medical practice you need to have to build insurances. Mm-hmm. We had to interview and hire companies to handle our electronic medical records, our billing, insurance credentialing. We engaged a very good business valuation expert who helped us with purchasing the clinic, hired an attorney to prepare the purchase agreement in a short period of time.
Yeah.
It was a lot. And so it wasn't uncommon for me to work 16 hours a day over those periods of time to get this thing off the ground.
Tell me a little bit about your background. How did you get started in physical therapy? We got a chance to talk a little bit before the show, and I could tell right away your level of commitment and heart is very, very apparent. And you know, as you get older, you get to make people much more quickly than you when you're younger. So I have that. I think I have that ability, and I caught that very, very credible. But how did you get started?
Well, thank you. Yeah, it's a field I'm very passionate about, and I'm lucky in the sense that I was able to find this field that just matched well with my thinking processes and what I am just naturally familiar with and have an interest in. And the long story is, when I was a freshman in high school, I decided I was going to try out for the football team. Had never played football before, really didn't know much about the game, but I wanted to be involved, you know, from a social aspect on the team and with the school. And I was just awful. And so after the week of tryouts, I was cut from the football team. And it really affected me. I was not happy about that. And I decided I was going to do something about it. So I stayed after school my entire freshman year doing strength and conditioning with whoever was there working out, whether it was the softball team, the soccer team, tennis team. I was right in the gym with them, working out, doing the drills, trying to improve my own physiology. And furthermore, I started taking electives academically on strength and conditioning and athletic training, anatomy and physiology. These were classes offered at my high school. And my sophomore year, I was able to not only make the football team, but I was starting running back for my football team all the way through my senior year. We had a very good football team. We actually made it to the semifinals for the state championship my senior year here in North Carolina. And so I was able to experience on my own how you can really transform yourself physically and meet these goals through strength and conditioning and training. And it wasn't until my senior year I was in an athletic training elective, and we had a physical therapist come and talk to our class. And I had never had physical therapy before. There were several times I probably should have had physical therapy. I'd, broken my collarbone twice. I had dislocated my thumb and, had tons of other injuries, but just, rubbed dirt on it and shook it off like we're told to do. But this physical therapist talked to our class about the profession. I said, man, that sounds like something I could really get into. I was already very passionate about anatomy and physiology and strength and conditioning. And if I could use that knowledge to help other people, that would be great. And so she said, all you need to do is do your 4-year undergraduate degree and then go to a 3-year graduate program.
Right.
And when you're a senior in high school, the last thing you want to do is 7 more years of school.
Right.
So I kind of forgot about it for a little bit. But when I went to UNCW for undergraduate and got my bachelor's of science in exercise physiology. And as I was there, I decided, physical therapy is something I would really like to do. I started doing volunteer work in physical therapy clinics and observation hours to learn more about the field, and did around 400 hours between the volunteer and observation over the course of a few years, and really decided this was something I would really enjoy doing.
Now you're at a point with Paragon where you can write your own book and do it in your own style, and really put your own signature on, I guess, how you see the world and how you want the public to see the physical therapy world.
Absolutely, and that's something I'm really looking forward to because,
right,
especially for a small clinic that is owned by somebody who's in the profession, we can really guide our practice to be most effective towards patient results rather than guiding it to just be a successful business. Obviously, we want it to be a successful business, but we want it to be successful because we're the best at accomplishing our goals in terms of getting our community better. Physical therapy is a very valuable tool in our medical system that a lot of times is not used correctly or is ignored, but physical therapy essentially teaches the body how to move correctly with its own mechanisms. The body is very good at taking care of itself if you know how to move it correctly. On top of that, we do a lot of physical medicine. So instead of using chemical medicine, such as pharmaceuticals and injections, we are using our knowledge of biomechanics, physics, anatomy, and physiology to treat people's bodies and restore proper movement, proper body mechanics, proper function. And when the body is moving in a healthy way, it's going to be able to avoid these musculoskeletal injuries. And so really I tell people physical therapy is the most effective to prevent having surgeries and to prevent having to rely on injections and these other medications. If we can get your movement patterns the way they need to be early on, that's where it's going to be the most effective for you.
So your audience, age-wise, runs a very wide, you cast a very wide net, don't you, age-wise?
For sure. We do not do pediatric physical therapy, meaning, if a kid is 10 years old or under, it takes a very skilled and creative clinician to be able to work with kids. You can't just tell a kid to, do 3 sets of 10 of an exercise. You have to come up with a game to make them move a certain way. And so there are very skilled pediatric physical therapists that specialize in that, and they're incredible people. It really is amazing to see them interact and work with kids and accomplish what they can. So,
right.
Usually 10 to 12 years old is about the youngest that we'll work with, that level of maturity. And I've had clients, well into their hundreds. I think my oldest client was 103 years old.
Oh, my goodness. Well, we're going to come back in the second set. I want you to talk in detail about the type of things you treat. You mentioned preventative PT. There's also post-op PT. And the things that you cover in your clinic they're wide, they're impressive. It would take way more than an hour to go through all of them, but we're going to start chipping away at it.
Sure. The neat thing about physical therapy is there are a lot of strategies to manipulate the body's anatomy and physiology. And some are very effective, some are not so effective. And so it takes some discretion and a lot of experience as a clinician to figure out what are going to be the best tools to keep in your toolbox. And you also want to take a lot of continuing education, because the more you learn about the different systems of the body and staying on top of current research, your umbrella gets bigger, and the more people you can fit under your umbrella, the better. So one kind of pitfall of our industry is what we call cookie cutter physical therapy. And we see this a lot with corporate-run physical therapy practices or practices that are part of a larger medical system, where the therapists are just inundated, and they may be seeing upwards of 20 patients a day. And regardless of how skilled you are as a physical therapist, if your time is split between so many patients, you're not going to be able to deliver effective care. And so one thing that we do is we keep a very low caseload and work with patients one-on-one and try and develop very personalized and individualized programs for patients.
Paragon Physical Therapy is still located in Olmsted Village in Pinehurst. You haven't changed your physical location. Let's come back. We'll talk to Dr. Jonathan Cole in the second set about some of the categories that he covers, and what people can expect. This is All Things Moore County. Welcome back to our second set of All Things Moore County. We're speaking with Dr. Jonathan Cole, who is the owner and the director of Paragon Physical Therapy, previously known as Appalachian Physical Therapy. And we are going to talk a lot about some of the things that you do and cover. The name you came up with, Paragon, is there a story behind it?
Well, the definition of Paragon is an example of excellence.
Yeah.
And that's always been my personal treatment philosophy, to be as excellent as I can be in all parts of my patient interaction, and all parts of what I do as a physical therapist. And we want that to be true for our clinic as well. We want to be excellent in how we handle everything from patient interactions, how we do our treatments, and everything in between, even with our administrative staff. So that's the reason we chose the name Paragon Physical Therapy.
Okay. And the staff that you've been with for a while, so you have a history.
We do. We have 4 physical therapists currently. We have my wife who works in the office as well. She helps deal with patients' insurances and builds our patient charts and handles all of that. We have a patient care coordinator named Lauren who's terrific. And we have physical therapy technicians who we usually hire students who are trying to get into physical therapy school. And so they will usually work with us for a year between when they finish undergrad while they're applying to PT school. And it gets them a lot of hands-on experience and patient interaction and really gets them well prepared for physical therapy school.
You mentioned the widespread of the age group of the people that you see. I'm sure there are certain things that people will know physical therapy. They think of, I had some post-surgery PT, I had a knee replacement, I have a sciatic issue. You must have a zillion reasons why people come in, and you cover a wide gambit of things, headaches, neurological, vertigo.
Right.
Really?
Right.
ACL injuries, neck pain, pelvic pain, joint replacement. I'm sure student athletic injuries. You mentioned your football career.
Absolutely. Even things that
Arthritis.
You may not would associate with physical therapy. All of our internal organs are held in place by insertional ligaments. We don't need our liver bouncing around, so there's a big ligament that holds the liver in place to the front of our abdomen called the falciform ligament, and it has attachments to our abdominal muscles, and there can actually be issues with internal organ motility when the musculoskeletal system is tight. And so it's not uncommon. Usually the patient isn't even coming in for this reason, but they're coming in with lower back pain.
Right.
And as we are working with them and helping them achieve their goals, they say, you know what, I am not having the same GI issues that I was having. I'm more regular in the bathroom. I'm not having pain during intercourse. And there's a lot of really interesting things that are tied to our anatomy and physiology that you wouldn't even think physical therapy could help with. But, it's all wrapped up in the same body, and there's a lot of interconnections there that can be important.
So, Dorothy, what he just said is that he looks at the totality of a host of things. It's not just one specific issue or item, but what's the interrelatedness of like organs with muscles, and so you're almost like a roving MRI machine.
Yeah, that can be one way to put it. We have an amazing connective tissue in our body called fascia.
Yeah.
And I explain it where if I had a magic gun from space where if I zapped you, it got rid of everything except your fascia, you would see this perfect cobweb-like outline of everything in your body. It goes around all of your muscles, all of your blood vessels, nerve vessels, all around your internal organs. And it's a very continuous structure. And if it becomes very tight, so imagine you're wearing a pajama onesie that's one size too small, you're not going to be able to move around in that pajama onesie too much. So when the fascial system develops a lot of restrictions, which happens for a multitude of reasons, the body can really start to become dysfunctional in all sorts of ways.
Mm-hmm. Do you offer Rolfing, massage therapy? When you mention fascia, I think of that connective tissue that gets tight on
Right.
a lot of people.
Yeah, there's a lot of ways to treat these connective tissues, and our clinicians have taking continuing education on several ways to treat that. Rolfing is very aggressive. It's not something we really use in physical therapy. Not to say that it doesn't work, but it doesn't have as much evidence-based reasoning behind it. And because it can be very aggressive, the compliance with patients isn't very good behind it. The treatment that we have found to be most successful is a treatment called Stecco method fascial manipulation, which was developed by essentially a family of physicians in Italy called the Steccos. There was a physical therapist, an orthopedic surgeon, and a physiatrist. They're all in the same family, but they've put a lot of time and research into the body's fascial system and collaborating with other scientists as well, and figuring out how to treat this system at a medical level. And a lot of that involves manual therapies. So what separates this technique from other just things like massage is the assessment. And when somebody is coming in, let's say somebody has knee pain, I care about the knee, but I'm more concerned about what happened before the knee. All right, was there a specific injury? Were you skiing and you twisted your knee? All right, that's straightforward. We know what to do there. If they said, well, it's just wear and tear, I'm just getting older, it's like, well, how come that's not happening to the other knee or all of your joints? There's a reason why this specific joint is dysfunctioning. Perhaps there was a prior injury to the foot and ankle. Perhaps there was a prior lower back injury. There could be a lot of factors that cause our body to start compensating, where we're walking differently, we're moving differently, getting in and out of our vehicle differently. And that change in mechanics can essentially wear down the joint differently over time and now create the dysfunction that person is having. So with fascial manipulation, the history is very important. And so we then not only assess where they're having the pain, but we'll also take into consideration distant parts of the body. I might even check into the trunk. I might check down into the foot and ankle. I might need to check over in the opposite leg. And we do a very thorough investigation of the connective tissues and formulate a treatment plan at that point. Our body can move in 3 planes of motion, forward and backward, side to side, and it can rotate. And so we usually start treating the connective tissue in the way it moves our body in one of those planes that has become the most dysfunctional, and we kind of chip away at it like that.
How do you fascially manipulate?
Yeah, so again, you imagine this matrix of connective tissue that is interwoven with everything. So it's part of our muscles, it surrounds our nerves and blood vessels, and it tries to allow the different structures in our body to move independent of each other. And when the connective tissue is normal, everything feels nice and soft, kind of like a rare steak. Whereas when there's injury present, or the person was immobilized, or maybe there was a lot of inflammation in the area for a while, that connective tissue changes its physiology. It becomes more rigid and it becomes more stiff. A lot of people have heard of hyaluronic acid. It's in a lot of beauty products, etc., but it's a very important substance in our body.
Right.
Hyaluronin, glycosaminoglycans, that is kind of our motor oil. That's the substance that allows these things to move separate of one another.
Right.
However, in these situations, like I was mentioning earlier, the hyaluronin it's a molecule chain that can start to overbind to itself, and instead of it imbibing water, it boxes out water and it causes the tissue to become stiff. And we can palpate this so that the tissue will feel much different to palpation. It's usually also tender to the patient. And we essentially do a very isolated friction massage on this area that is bound up. And we're essentially breaking up the adhesions between these different layers of the body. We're trying to restore these structures to move independent of one another and slide and glide. These structures are also very highly innervated. There's a lot of nerve endings in the structure that helps tell our brain where we are in space, what direction we're moving, what position we're in, how fast we're moving. And when we become tight, that information becomes corrupt, and now we're changing our movement patterns. So by loosening up the tissue, not only can it help with the movement of that local area, but we also improve our neurological system. Our proprioceptive information is better, and we restore normal movement mechanics as well.
It sounds like what you're talking about would relate to back pain and sciatica.
Yeah, back pain and sciatica are some of the most common things that we work with. And
Right.
The reason is that's where our center of mass is located. You cannot do much movement without your lower back being involved in some way, shape, or form. So lower back pain can also be very complicated because even though the lower back is taking stress and that's where we're feeling pain, the movement dysfunction could be anywhere in the body. It could be in the foot and the ankle. It could be in the hand and the wrist. If your arm isn't moving like it's supposed to reach into that overhead cabinet, you're going to tilt and side bend your trunk to get your arm up there.
Right.
You do that, for 5 or 6 years, you're going to start having back pain. So lower back is a very common issue that people have because any kind of movement dysfunction is going to put stress on the lower back.
Is arthritis a big issue for you with a lot of patients?
Not as big of an issue as people like to see them. I mean,
Okay.
Arthritis essentially means inflammation of a joint. What we usually think about is osteoarthritis, which means the inflammation is coming from a degeneration of the bones. But if you take an X-ray or an MRI of anybody over 50 years old, they're going to have degeneration. It's gravity. You can't escape it. But the presence of that degeneration alone is not enough to be responsible for all of our pain. It needs to be taken into consideration, but sometimes I think we give it too much credit.
Okay. Let's come back in the third set and talk shop some more. Our guest is Dr. Jonathan Cole. He is the clinic director, the owner of Paragon Physical Therapy, located in Olmsted Village in Pinehurst, and it is a new beginning. After 15 years, you get the opportunity to put your own signature on the kind of practice that you want to run and the way you want to treat people. This is All Things Moore County. We'll be right back. Welcome back to our third and final set with Dr. Jonathan Cole, the clinic director and owner of Paragon Physical Therapy. There's so many things that you cover: sports injuries, pre and post surgical rehabs, I guess elbows, knees, backs, fingers, trigger fingers, I'm sure.
Yeah.
Hand therapies, joint replacements, rotator. I mean, talk to me about some of the things that you do and you get involved in that people would want to hear about.
Sure. Well, first, I would be completely amiss if I didn't talk about the environment of our clinic and the culture that we have. So when people come in, we want it to be a very warm environment. I mentioned we have a terrific staff earlier, and a lot of times when you come in, you're going to just hear tons of laughter. We get along with our patients. Because we do one-on-one therapy, we get to know our patients really well and have a lot of fun conversations with them. They're there, they're working hard, we're working hard, but it doesn't need to be a miserable experience as physical therapy sometimes can be. We also have a few therapy dogs at our clinic that are usually a big hit. If people don't want the dogs around, they don't need to be around, but we usually have a couple friendly dogs that make people feel better and cheer them up as well.
Oh.
So it's also just a fun place to be. So I wanted to mention that.
Yeah.
But getting into treatment a little bit more, I mentioned earlier that we really pride ourselves on offering personalized treatment. We do an in-depth assessment and figure out what is that individual's problems. Where are they lacking strength? Where are they lacking mobility? Where are they having trouble with the activities they enjoy? How's their quality of life being impacted by this? And that's where we focus our treatment. Our therapists, like I mentioned, have taken dozens of continuing education courses that focus on those patient outcomes. We don't want to just check the box of getting the CEUs needed to maintain your license. We want to get continuing education that'll make a difference for our patients.
Right.
We have a therapist named Jennifer Smith, who is a pelvic health specialist, and she also specializes in pain neuroscience, which is very interesting. It's how these emotional traumas can manifest physically. So when people have things like fibromyalgia, a lot of times there can be an emotional component to that. And Jen is very skilled at working with patients that have chronic pain and figuring that out. We have a therapist named Dr. Brooks Brady, who is taking courses in LSVT Big, which is specific for treating Parkinson's disease. She has 2 very athletic kids who are great golfers in their own right, and she is taking courses with Titleist called Titleist Performance Institute, which focuses on biomechanical analysis of golf swings and helping people that want to be able to play golf better, which obviously is huge in Pinehurst, especially everybody being fired up out after the U.S. Open.
Right.
They want to get out on the course, and if they can't, this Titleist Performance Institute can really focus on what's wrong with your golf swing from a biomechanical standpoint and what kind of treatments do we need to do to allow your golf swing to be mechanically better. We have another therapist named Dr. Lyndon Dice, who's very focused on strength and conditioning. She's a very good athlete in her own right, was a collegiate basketball player, and she really likes to focus on strength and conditioning, and a lot of her patients are very athletic, whether they are bodybuilders, martial artists. She's very skilled at handling that demographic. So we have several clinicians who don't all specialize in the same exact thing, but that allows us to have a very big umbrella where we can treat a lot of different people dealing with different issues. And I haven't gotten to a question you've posed probably twice so far about pre-surgical and post-surgical rehab. Like I mentioned earlier, physical therapy is best used as a preventative measure. And there's tons of great research that shows even doing physical therapy for 3 weeks before an orthopedic surgery, whether you're getting a joint replacement, rotator cuff repair, spine surgery, the better condition your body is going into that surgery, the better it's going to heal on the other side. And the reason is when you start conditioning an area, your body builds more blood vessels, there's a better neuromuscular connection there, and that's just going to help you on the other end. People that need to have an orthopedic surgery, at that point, we're not trying to prevent the surgery. We know things are mechanically not going to be able to recover naturally at that point, but we can still make the recovery process better by getting the area of the body in better condition going in. And then, of course, after surgery, I always tell people, let's say you get a joint replacement. We're not treating the arthritis anymore. You don't have arthritis in that joint once it's been replaced. What we are treating at that point is the injury caused from the surgery itself. And sometimes that people don't realize that, but a surgery is a very invasive procedure and it causes injury. They're cutting tissues, they're cutting bone, and your body is going to take several months to get over that. So when we're working with somebody after a surgery, it's all about doing the right things at the right time. A lot of people might get in trouble by trying to do too much too soon. If you're overexerting yourself too early in the healing process, you're going to cause more inflammation and slow down the healing process. Obviously, if you're not moving enough or you're not moving in the right way, your body can lock up and freeze up and you can lose range of motion. The good thing about rehab after a surgery is we know exactly what happened. And again, if we're doing the right thing at the right time, we can usually get people on a good track to recovery.
Okay. You do dry needling?
We do, yeah. Actually, some of our clinicians, even at Appalachian Physical Therapy, were the first physical therapists in North Carolina to become certified in dry needling. Dry needling...
Different from acupuncture?
It's different than acupuncture. It uses the same instrument, but there's a different philosophy behind it, and the treatment method can be different as well. So I'm not an acupuncturist and haven't studied acupuncture, but acupuncture is based off of Eastern medicinal practices, whereas dry needling is based more on Western medical practices, and we're treating the physiological issues that we're finding with the instruments. So dry needling essentially involves placing a small solid filament needle, so it's not a hypodermic needle like you'd get a shot with, it's just a very small solid filament, and we place it into the physiological structure that is having trouble. And to make things more confusing, there's a few different ways to do dry needling. There's neuropathic dry needling, where we can put some needles along the path of a nerve and hook up electrical stimulation, so it's kind of like TENS, and that can help decrease the pain that is being sent through the nerve. There can be what we call static dry needling, which is almost more similar to acupuncture, where we put the needles into a structure and leave them there for a period of time. And what we find is that helps trick the body into creating a healing process. We put several needles, let's say somebody sprained their ankle, we put several needles around the sprain. The body says, hey, what are these foreign objects doing here? And it helps jumpstart a healing process, and that's one way to use dry needling. And then there's trigger point dry needling, where if we find tightness in the muscles, so I'll use this a lot after I've done the fascial manipulation assessment, and we find that there's areas that are just really tight, maybe they're not responding to the manual stuff that we're doing, we can use the needle to actually release tension in the muscle and the fascial structures directly.
Okay. I want to switch back gears just a little bit. A lot of people I speak to who wind up going to physical therapy seem to go for post-operative issues. A joint replacement seems to be very common in knee, hip, and it's great to hear some of the people who have had these things done. They rave about their PT, but they have to be judicious, they have to be disciplined, and to get the recovery going as quickly as possible. A knee, I think, more than the hip, right?
Yeah, the hip is really interesting. You would think with it being such a big joint and being deeper in the body, it would be a tougher recovery process, but the hip tends to really heal well. There's a hip replacement procedure where the surgeon can go in through the front of the hip and not have to cut through any muscles or tendons. And the healing process can be extremely quick with that. It's almost an outpatient procedure.
It's crazy. That's crazy.
The older hip replacements where they go in through the back of the hip, they have to cut through more muscles, and a lot of patients were left with permanent weakness because of that and had a much tougher healing process. The joint is more susceptible to dislocating. So these newer anterior hip replacements are pretty remarkable.
We're running, unfortunately, short on time. There's so much stuff here. People can start the process, I guess, by getting onto your website to see the vast array of services that you offer.
Yes, absolutely. Our website is up and running. It is pinehurstpt.com. On the homepage, you can scroll through and look at the different treatments that we do. And we also have a link where you can schedule a free consultation if you just want to meet with one of our therapists. We can interview you, see what's going on, see what your problems are. And, first of all, let you know if PT is something that you need to do and if we can help you out. And if it is, we'll discuss what that treatment would look like for you.
And the insurances that you accept?
Yep, we accept Medicare. We accept TRICARE. We are in the credentialing process with Blue Cross Blue Shield. Any insurance we're not in network with usually has out-of-network benefits, and we can call them on your behalf, see what your out-of-network benefits are, and let you know how your insurance can help you out with treatment.
Okay. You lived up to your billing. I want to tell you, it's been very good to have you on and listen to you speak. Wish you all the best of luck with your venture. I don't think you're going to need luck. Your commitment is impressive. Dr. Jonathan Cole, Paragon Physical Therapy, located in Olmsted Village. Thanks for coming to join us.
Thank you so much for having me. This is great.
I enjoyed it. Everybody, have a great week. This is All Things Moore County.